So I decided for the format this morning that I would ask about 12 different questions. Now these probably, you have other questions, I know, but these are at least 12 questions that I thought would be of interest to the group. And the first question is, what is the relationship of serous borderline tumor to low-grade serous ovarian cancer, which is a common question. So we do believe that serous borderline tumor is a precursor to the development of low-grade serous ovarian cancers, and although we don't know it, it's possible that every woman who develops low-grade serous ovarian cancer did initially have a serous borderline tumor. The risk factors for serous borderline tumor are infertility and hormone replacement therapy, taking estrogen. There's a question about whether fertility drugs also increase the risk of a serous borderline tumor, but that's not been validated. For stage 1 serous borderline tumors confined to the ovary, the treatment is very simple. It's surgery alone, and the cure rate is over 99%. However, for stage 2, 3, and 4, serous borderline tumor, and this means that there are implants within the peritoneal cavity, in the omentum or in the peritoneal lining, that are usually non-invasive. Surgery alone is still the treatment. However, if the peritoneal implants include what's called invasive, or used to be called invasive peritoneal implants, and now is synonymous with low-grade serous carcinoma, then in addition to surgery, obviously postoperative therapy is necessary. We also know that about 20% of women who are diagnosed with low-grade serous carcinoma have a prior history of serous borderline tumor. And at the time of diagnosis of low-grade serous ovarian cancer, about 60% also have areas of serous borderline tumor. So there's a very, very tight relationship between these two entities.